Welcome to all the members of this CECE event, including the interprofessional student and faculty involvement. This is the Blanket Project, and we worked on building community through comfort.
This collaborative service learning project involved a team of Bachelor of Science and nursing students from UNE's Portland and Biddeford campuses with the assistance of faculty members Tricia A. Mason and Professor Esmeralda Uwola to connect with and assist marginalized communities in Portland, Maine. Overall, collaboration between the students and faculty enabled the creation of 15 fleece snow blankets with laminated note cards that included inspirational messages and community resources, which were delivered to a homeless day shelter and food distribution center named Preble Street to support local people in need. So to make this happen, as a group, we developed a grant proposal to receive funding for this project, collaborated over Zoom to make the grant proposal and to formulate a plan to make the blankets and note cards. To make the blankets, we all met at UNE's Portland campus, and then we delivered these supplies to Preble Street. And from there, the center staff then distributed the blankets and note cards to their consumers, those suffering from mental illness, homelessness, and addiction.
Laminated note cards included local contact information and resources to Portland, Maine. This included affordable food resource programs and food shelter locations, addiction helplines, resources for individuals under the age of 18, homeless shelters and affordable housing programs, and the Milestone Foundation Recovery Center. These cards also included words of affirmation to help the individuals who received the bags get through tough times. An example of the affirmations mentioned on the cards included believe in yourself, you are braver than you think, and the sun will rise again tomorrow.
To make this project possible, we worked with multiple different organizations. For example, the Donation Center team at Preble Street Shelter, Joanne's Fabric Store for the blanket supplies, and then multiple faculty at UNE. As mentioned before, we worked with Tricia Mason and Professor Uyoa, and also Shelley Conrad.
So we, as a group, decided to do this project more independently, which allowed a lot of these blankets to be done on students' own time. This was beneficial as the hefty workload students often have didn't affect the completion of the project. Next time, I would definitely recommend more concrete deadlines and more time management skills, as I feel like the wish-washy of everything made group participation a little bit more difficult to achieve. However, overall, we are so happy with the results and how everything turned out. And I know that a lot of individuals in need have been helped. So I'm very happy about everything and how it happened. If you guys have any questions, please reach out. Sadly, because of class scheduling, we weren't able to make it to the event, but our emails are listed in the PowerPoint and we will get back to you as soon as we can. Thanks, everyone. Have a great day.
All right, let's go ahead and we'll get started. So our first presentation today is the Blanket Project, building community through comfort. And if you can't hear at any point in time, please stop me before it gets to the whole video.
Welcome to all the members of this CECE event, including the interprofessional student and faculty involvement. This is the Blanket Project, and we worked on building community through comfort.
This collaborative service learning project involved a team of Bachelor of Science and nursing students from UNE's Portland and Biddeford campuses with the assistance of faculty members Tricia A. Mason and Professor Esmeralda Uwola to connect with and assist marginalized communities in Portland, Maine. Overall, collaboration between the students and faculty enabled the creation of 15 fleece snow blankets with laminated note cards that included inspirational messages and community resources, which were delivered to a homeless day shelter and food distribution center named Preble Street to support local people in need. So to make this happen, as a group, we developed a grant proposal to receive funding for this project, collaborated over Zoom to make the grant proposal and to formulate a plan to make the blankets and note cards. To make the blankets, we all met at UNE's Portland campus, and then we delivered these supplies to Preble Street. And from there, the center staff then distributed the blankets and note cards to their consumers, those suffering from mental illness, homelessness, and addiction.
Laminated note cards included local contact information and resources to Portland, Maine. This included affordable food resource programs and food shelter locations, addiction helplines, resources for individuals under the age of 18, homeless shelters and affordable housing programs, and the Milestone Foundation Recovery Center. These cards also included words of affirmation to help the individuals who received the bags get through tough times. An example of the affirmations mentioned on the cards included believe in yourself, you are braver than you think, and the sun will rise again tomorrow.
To make this project possible, we worked with multiple different organizations. For example, the Donation Center team at Preble Street Shelter, Joanne's Fabric Store for the blanket supplies, and then multiple faculty at UNE. As mentioned before, we worked with Trisha Mason and Professor Ulloa, and also Shelley Conrad.
So we, as a group, decided to do this project more independently, which allowed a lot of these blankets to be done on students' own time. This was beneficial as the hefty workload students often have didn't affect the completion of the project. Next time, I would definitely recommend more concrete deadlines and more time management skills, as I feel like the wish-washy of everything made group participation a little bit more difficult to achieve. However, overall, we are so happy with the results and how everything turned out. And I know that a lot of individuals in need have been helped. So I'm very happy about everything and how it happened. If you guys have any questions, please reach out. Sadly, because of class scheduling, we weren't able to make it to the event, but our emails are listed in the PowerPoint and we will get back to you as soon as we can. Thanks, everyone. Have a great day.
So is none of the students from the team actually be able to make it here? Is that kind of what happened? But we do have a few minutes if people want to discuss it. I mean, that was a really brilliant idea. If they were here, I was actually going to ask them how they, identify what the needs the people need, like have, and the resources they put on the cards. But any one of you, if you want to share a little bit your experience, maybe participate in something similar in the past and how you would have solved some of the problems, feel free to chime in.
I really like that they mentioned what they needed to work on in the future. Sticking to a timeline is so important. And if you don't give yourself a deadline, I find that I just will keep on pushing it back. So I really liked that they mentioned that moving forward, they know what they'll do next time. I also think that it looks like it was all nursing students. This could be a really great opportunity to get interprofessional students in it. I'm thinking that while you're tying those blankets would be a great time to be talking and discussing the project with others. So maybe for the future.
Exactly. That's kind of reminded me of the mask making project during COVID time, that right after we shut down the school, and then a lot of us kind of jumped in and making masks. Anyone else want to share your experience? How do you find the local resources? Maybe we've got quite a group here.
Hi, I joined a little late. Sorry, I'm in clinic right now.
Hi, Allie.
Good to see you.
Would you like to share some? So I don't know how much you heard about that presentation. a group of students, they actually made a blanket for the local shelter. And then they also sending cards with information, phone numbers and the organizations that people could reach out to.
That's awesome.
If you would like to share some of your experience. That would be
Oh
great.
yeah, you mean finding resources for the project? Yeah, our patient was set in Maine. I lived in Maine for my first 2 years of med school, but I haven't been there in almost a year and a half. So it was a lot of Googling for me. And usually like you'll find a website and then there's a link within that website that takes you to another website. So that's kind of what I did specifically for finding. Ours was financial toxicity. So a lot of the like heating resources and, if certain incomes qualify for different things. So on my part, it was a lot of Googling. I wasn't able to drive around and get resources in a more fun way, unfortunately.
So it looks like we have about 1 more minute until we get started. So this would be a great time if anyone would like to transfer to another break room. Now is a great time to do that. Do we have team members present for our next presentation, which is gender affirming act? Okay, great. Okay, I'm gonna go ahead and share my screen. And yeah, if those group members want to introduce themselves, that would be great.
So actually, I want to say the next 3 project is all from this new IPE program. It's called a FIT. So it's basically we're using public health problem solving paradigm and use that in patient-centered care. So a student as a team and learn about the paradigm and also learn how to use that to actually generate a patient-centered framework. So in all the presentations, you will hear the case and then you will see the framework they come up with. And the purpose of generating the framework is actually looking at the patient from all aspects. So not just the disease, not just the individual, but also the environment they're living in, the interactions they have with other people, their social relationships, and then identify what's their needs. So their needs probably not only the medication, but also other things for improve their overall life quality. So hopefully, a lot of you will become more interested after their presentation. And if you are thinking about participating, just contact me directly and we can make it happen.
Hi, everyone. This is Adaptation of Public Health Problem-Solving Paradigm in Interprofessional Training, which is FIT. This is a 12-week elective program that's offered to UNE health professional students and undergraduate students in relevant programs, majors such as public health, that are interested more about IPE. So in this program, we learn about public health problem-solving paradigms for one specific case study, and then build a patient-centered framework for that.
We expanded on a case that was initially developed by Carrie Bonart at the University of Louisville and her collaborators. This fictional case is about Taylor Nichols, a 32-year-old transgender female from South Portland, who is establishing primary care and seeking gender-affirming hormone prescriptions. Taylor has not seen a doctor since she was 18 and is concerned about her cancer risk, what vaccinations she may need, and any untreated medical conditions. As you can see, she has a number of untreated medical conditions. She does use hormones that she got from the internet. Her family history is significant for diabetes, high blood pressure, heart disease, and cancer. Her social and personal health factors include some opportunities for improvement that we'll discuss later.
So we chose the teardrop infographic because, as you can see, the individual is at the center of patient care, and there are multiple aspects affecting the patient, such as her community, social networks, and societal factors as well. We highlighted positive factors for her health in green and negative factors for her health in red. We chose to focus for interventions on her asthma and suicide attempt at 16 years old. So we are going to reevaluate for mental health and see how asthma may be affecting where she's living.
These are some of our interventions that are based in Maine. The first one's the Transgender Law Center, which is for life planning documents for transgender communities and also offers multiple resources. Open Door Transgender Healthcare at Maine Family Planning. This is offered in Lewiston and Waterville locations. And it's hormonal transition therapy and monitoring for those 18 years and older. It offers on-site injection lessons and supplies for hormonal injections and some referrals to specialty providers, as well as preventative care and STD testing and treatments.
Given her medical history, we offered up a few medical interventions. So these included some pharmacological interventions such as albuterol inhaler, metformin, Wellbutrin, but we also offered some behavioral interventions as well, such as consulting a nutritionist, referring them to SAMHSA National Helpline, also referral to a therapist or a psychiatrist as well. And then overall, this experience and being part of this IP program was really wonderful for all of us, and we really enjoyed it.
I was just saying all the members are here and feel free with your questions. I see Dr. Sigo is here as well.
I really liked how you guys elaborated on your teardrop model. I think it was really important to put the patient in the center. And I think by having that, we have a better understanding of how all of these different factors are affecting her and her overall well-being.
This is a small thing, but I think it was really helpful that you put them in different colors, the positive ones in green and the negative ones in red. That's just good visually.
And also in terms of intervention, you could actually promoting more positive factors based on the framework as well.
So I'm curious, what were some unexpected barriers that you all noticed when you were finding your research and resources?
Yeah, that's a really good question. And I think one of the things that I took for granted when finding resources is I can just Google things. And that's because I have reliable access to the internet. I speak English, and all of these resources are pretty readily available. And I'm very comfortable on the internet and with a computer. But just keeping in mind that giving someone a list of hyperlinks might not be usable for them, maybe because of a language barrier, or maybe because they don't have a smartphone or a computer. Maybe they don't have a phone at all, so phone numbers maybe aren't helpful, and that's where addresses and person-to-person contact can be really important. And so making sure that you understand the needs of that individual, so you're not just sort of assuming their needs, but then also understanding what strengths they have and what supports they have and whether they have a phone or not, and understanding that so that you can really tailor our solutions to them instead of just throwing a bunch of resources at them that they can't use.
Absolutely. That seems so important. I'm in an elementary school right now doing my clinical, and sometimes you forget even words that, we use every single day are words that kids have never heard before. They don't understand what you're asking. And so if we're putting all these expectations, but people don't have the means, or they don't understand what you're saying, what they're supposed to do, you can't even get started. Thank you for sharing.
Yeah, I think a common vocabulary is so important between healthcare providers and not, and then amongst healthcare providers. And that's something that the interprofessional experience allowed us all to see is where do we have a common language and where do we need to make sure that we are using less technical jargon.
So one thing I thought it was interesting your team found about the air quality in Portland area, South Portland, the Portland area. Do you want to just elaborate a little bit on that?
Sure, I can. So our patient had asthma risk, and she was also living in Portland, and we found that there was an EPA issued warning that there was high levels of petroleum around schools, and specifically USM, where she is also a librarian. So we weren't going to suggest that she move, but just make her aware that that may be exacerbating her asthma.
Yeah, that was really interesting. a regular practitioner probably doesn't even have that information. And it was a great, you guys actually found out.
So hi everyone, we're 4 students from the UNE health programs. We're part of different health programs, and today we are here to present our PHIT program, which we all did together. This semester we were part of this program. This is an interprofessional program where we collaborated to create a patient case in order to explore how the social determinants of health and various factors can impact a patient. Our patient today is James, who is an 87-year-old Caucasian male. Can we go to the next slide? Who is a retired educator from Portland and a widowed father of 6. He has a significant past medical history of multiple concussions from high school sports and back injuries from his time in the military and multiple MBAs. He has been experiencing chronic neuropathic pain affecting his entire body since 2013, and since then has been diagnosed with back pain, postherpetic neuralgia, and cardiovascular disease, and has gone through countless medical and holistic therapies as displayed on the slide. He has been seen by several ER docs, primary care physicians, and pain specialists without any relief. In fact, his pain symptoms have only increased, and he is now experiencing weakness.
Regarding his social life, his wife is deceased due to cancer, and he lives with one of his sons, with the remaining sons living nearby. Due to pain, James is unable to do the things that he once enjoyed, such as walking around Back Cove or playing games with his friends. Since he has to rely on others for transportation, he has a difficult time getting to appointments and purchasing groceries, therefore resulting in poor nutrition due to eating takeaway and fast food.
Okay, so here is an image of our framework that we created for this course, which lays out positive and negative factors affecting James' life and contribute to his current status. We determined that the main problems for James were his access to care, transportation, limited mobility, and function due to his chronic pain and his nutrition status. So we laid out solutions for this case involving opportunities for transportation through local medical and religious organizations, access to healthy meals for meal services such as Meals on Wheels, and suggested telehealth visits to decrease reliance on transportation, as well as additional referrals to other specialists that could help them with this pain from a different angle. We also suggested local community support groups, such as those run by the local chapter of the U.S. Pain Foundation, that could help to connect him to others who experience chronic pain.
So overall, we found that it is important to apply an interprofessional approach to care, as there are many aspects of a patient's life that could be impacting the reason that a healthcare provider is seeing them. It's also important to consider the impact of chronic pain on all other aspects of someone's life and to be aware of local resources so you can refer accordingly. It was helpful to create a framework, and this is something that could be applied to real-life patient cases in order to better understand what factors influence a patient's health and what barriers they may be facing.
All right, feel free with your questions. This is a really complex case.
I really liked your slide showing that showing all of the different images of the help that you can receive. I think going back to Ben's earlier point about how using common language is really important. I think that just aids in the ability to understand, what factors there are to help your patient.
So a question for the team. So, apparently he would need a lot of help from different perspective. In your opinion, what would be the top priority for him?
Yeah, it's kind of go ahead.
Oh, sorry. I was just going to say, that's a loaded question. There's just so many problems things that are going on, right? So it really, when it comes down to prioritizing things, the way I would have approached it would have been start with what's the most immediately manageable thing. And that would have been kind of just, hey, maybe talking to his current providers and be like, can we switch him to a more telehealth model of practice, because he clearly can't make his appointments because of lack of transportation, and also just the meal services, because those are some of the things that are going to immediately impact his life and his ability to function. Just the fact that he has access to now healthier meals because he is able to get in touch with those organizations that can kind of provide him with the healthier meals that he needs. So fortunately, our patient was someone who, he was a retired educator. He was, so he had like a good level of education, and he was able to navigate technology and, access resources quite well, which might not be the case for everyone else. So just kind of getting him in touch with these people who can get him those resources that he needs would have been the most immediate, I guess, way to solve some of the problems that he's facing.
Yeah, and then to add to that too, I think just considering like what his goals are. So if his primary goal is to live without pain, then pretty much, offering resources in order to tackle that. Or if his primary goal is to walk around Back Cove, then we'll focus on that. So I think, yeah, patient goals would be something that I personally would focus on as well.
Yeah, that's definitely really important. I mean, in our program, we don't have a real patient contact. So that's the part that we could not interview a patient to find out. But in reality, based on the framework and then based on what you guys learned, it's really important to include patient in your team, right? So you could even include the patient to generate the framework, because you do need a lot of information from them, and then really find out what's their priority. That's really important.
I think this case did such a great job highlighting two very large challenges right now in healthcare too. So not only chronic pain, but the struggle of independence, right? Is he safe to live at home? Maybe. Does he need to go somewhere else, but does he not want to? I think those are really big questions right now, and we're seeing that in a lot of places too. Great job, you guys. I really enjoyed that. And we have time for about 2 more questions if anyone else has anything to ask or add. I'm wondering if each team member can share like one major takeaway that they took from this case that they will be utilizing in practice.
Yeah, I think for me, just figuring out like what local resources are available, because I mean, a lot of us aren't going to stay in Maine. So figuring out like what options we have to provide for patients would be important.
Yeah, kind of echoing what Annie just said, especially like, I'm a second-year med student, like chronic pain is something that we're going to be dealing with on a very regular basis. And so kind of just having the options, like I learned that there were so many options to treat chronic pain that were like, just more than medications and like OMM treatments that we learned. So just like navigating all those options for treatment and approaches, and kind of like what the patient is willing to try, and what's kind of like their comfort level, kind of meeting them in the middle. That's kind of my most important takeaway from it.
Yeah, kind of also going off of that, as a public health major, just being aware of available resources in the area and how to connect your patient with someone who, like, maybe you don't know exactly how to help them, but someone who can, and just being aware of those options is really important.
I think for me, the biggest takeaway I had was just like the importance of knowing your patients well. Like I think like this was a fictional case, but we kind of do a lot about our patients like personal needs and background. And to get back to what Rich was saying earlier about like the question, right? Like, it's until you know everything about your patient, you're not able to prioritize for them, look into all these different situations that you do. So that was just the takeaway.
I think a lot of times, only when you become a patient yourself, you understand the struggle. So, just taking time to find the local resources, I think that helps you to understand how difficult it would be for the patient themselves to find the local resources. So I'm glad you guys all did the hard work, and hopefully it will be helpful for the future.
In 2021, there were over 9,500 overdoses in the state of Maine, 627 of which were fatal. Fentanyl, a synthetic opioid that is between 50 and 100 times stronger than morphine, was involved in 77% of the deadly overdoses in Maine. Between 2021 and the first half of 2022, there's been a 9% increase in fatal overdoses, with 19% of those fatalities occurring within Cumberland County. Hi, my name is Elise Parker, and I'm a second-year occupational therapy student who served as a team leader for both the service learning opportunity and the CECE mini grant that funded the project. The CECE mini grant was completed in the spring of 2022 by Kaylee McCrory, a second-year OT student, and Hannah Hutchins, a first-year OT student. We were provided support by Jan Froelich, an associate professor in the occupational therapy department, and Dr. Dana Lawham, the assistant clinical professor of nursing. Chris Hall from CECE and Tricia Mason, the director of the Westbrook College of Health Profession Service Learning, assisted with planning, organizing, and executing the service learning project. Research has shown that the first 2 weeks following reentry, an individual with substance use disorder, otherwise known as SUD, is 120 times more likely to overdose than the general public. This project, Partnerships in Harm Reduction, Campus to Community Engagement, was an opportunity to introduce multidisciplinary healthcare students and future providers to the realities, challenges, and stigma that is commonly faced by individuals with SUD within the criminal justice system, to raise awareness, educate, and emphasize the importance of providing quality services to support successful reentry. In order to better understand and identify the specific needs of community members that would support their reentry, we engaged in a focus group with both male and female residents from the Cumberland County Jail. Both groups emphasize the importance of being supplied with materials that fall into 3 overarching categories. 1, tangible supplies such as naloxone or Narcan, fentanyl testing strips, and hygiene products. 2, resources on housing, employment opportunities, and where to obtain additional supplies. And 3, something that would foster a sense of connection within the community. With the financial support of the mini grant, in addition to several local organizations listed in the acknowledgement section, we were able to gather 10 interprofessional students to assemble 200 harm reduction kits to meet the needs of these individuals. Included in each kit was a handwritten card from one of the UNE students who participated in the harm reduction kit assembly at CCJ to demonstrate acceptance, compassion, and hope for those reentering. Additionally, we created 60 wellness kits for the correctional officers at CCJ that included supplies for stress reduction and a handwritten card to express the gratitude that we have for the work that they do and to highlight the importance of their role in distributing the harm reduction kits. This assembly served as an excellent opportunity to discuss the unique role that healthcare providers have in reducing stigma and promoting access to care for underserved individuals within the community. As a result of this project, we increased awareness of harm reduction principles, practices, and programs for healthcare profession students. We emphasized the relevance of the continuum of care, social determinants of health, and providing client-centered care for future healthcare professionals. And we supplied CCJ with 200 harm reduction kits and 60 correctional officer wellness kits to support resident reentry success. Do you have any questions?
Really interesting project. So I just wondering, do you guys have any follow-up? Was there any individuals who received the kit, or was he in a focus group?
You know, that's a great question. I'm not sure if Chris Hall is in here and if she has any updates. What we do know is that these kits were handed out specifically to individuals who, the individuals at Cumberland County Jail who helped us make these, they're in charge of distributing them. So they're identifying those who would benefit most from them and handing them out. But we have not heard any updates so far as I know.
Mm-hmm.
We do know.
Oh, sorry. I just wondering, is this going to be a continuation project? Is there any other student kind of pick up the project?
Yes, so the goal is to make this a project that would be sustainable. We actually have a meeting tonight to discuss further grant proposals. So if anyone is interested in that, please feel free to reach out to me. We would love to add you to our crew. But yes, the goal is to make this a sustainable project.
Talk a little bit about your experience in working with a law enforcement sort of agency through the Cumberland County Corrections. I know the working relationship between harm reduction and law enforcement has sometimes been a little bit tenuous. And I think this is a great environment where you're interfacing with law enforcement in a setting where there is not incentive to make drug arrests or to prosecute. But can you tell us a little bit more about that experience?
Absolutely. And that's a great question. So we work both with the MDOC, so the Maine Department of Corrections, and for this project specifically, we were with Cumberland County Jail. And there's a pretty big difference between working with prisons and then working with the jails. UNE has a great relationship with Cumberland County Jail because we supply them with so many other service learning opportunities. And we were fortunate that there were individuals at Cumberland County Jail that were really excited to get this project started. They had had naloxone in their possession for months, maybe years on end, waiting to get this project started. So there were a few individuals that were very excited about it. Our idea for creating the wellness bags was how we wanted to get the correctional officers on board with what we were doing. We really wanted to highlight that the handoff, the giving of the bag is an excellent opportunity for connection. And so we really wanted to stress to them that we appreciate the correctional officers. We know that they're doing very hard work and that they're putting in a lot of effort. And we want to make sure that they're feeling as though we appreciate them and we acknowledge their hard work and that they're able to hand it to the individuals re-entering with kindness and compassion as well.
I think this is a really phenomenal project, and I'm glad to see folks from across our programs working on it. This is something I would be interested in helping to support as a faculty member. I have some contacts with Portland Overdose Prevention and Church of Safe Injection that we actually engaged in our state PA conference this year. And it is a big area of personal interest for me. I think the folks approaching our substance use disorder epidemic from a harm reduction perspective really have the right perspective and are really onto something with how they're approaching some of these problems from a patient-centered perspective.
Well, thank you so much. We would love to have you on our team.
So I would just like to add that we've been working very hard with the Maine Department of Corrections to develop a strong relationship. And if you are interested even further, we will be hosting a knowledge exchange and a follow-up conversation cafe. But what I really want to say is that they have developed what they're calling a humanistic approach to working with people who are incarcerated. And it's a very different approach, as you probably know, Chris, from other states or other programs. They are working to create relationship with people who have been terribly marginalized and basically invisible. And that's not to excuse people for crimes they commit, but to recognize that everyone needs to be treated as a human being. So they're going to be presenting. And then the following Monday, we're going to follow it up with an in-person conversation, which will include folks who will be on the panel. So I'm hoping that many of you will participate in that, and don't worry, we'll let you know when it's happening. We're good with that.
It is March 1st, and I've dropped the information in the chat for everybody.
There we go.
Everyone really did an excellent job, and nice working with all of you.